Cardiovascular is actually referred to the system in body that includes heart and blood vessels such as artery, veins, and capillaries. This system is responsible for circulating blood throughout the body supply, such as for oxygen, nutrient, hormone, and other vital substances to both tissue and organ. Meanwhile, it is also removing waste products like carbon dioxide. And here is all the functions of cardiovascular. It is for oxygen delivery, waste removal, hormone transport, temperature regulation, immune transport. All of this is giving us a lot of benefit. But for today's video, we are going to investigate how gender-specific differences in cardiovascular health. It is because both gender has a different in risk factors, disease presentation that influenced by hormone, lifestyle, and genetic factors. It is because both gender has a different.
Okay, next, let's move on the factors that affect the cardiovascular health, which is the lifestyle factors. How daily life habits differ in men and women. First one, we have the physical activity. For men, they tend to engage in more vigorous activities, for example, like weightlifting or sports, which can benefit cardiovascular health but may lack consistency in aerobic exercise, for example, walking or running. While for women, they are more likely to engage in moderate activities such as yoga, walking, or household chores, which support health but may not provide the intensity needed for the maximum cardiovascular benefits. Second is the smoking and alcohol use. For men, they have higher rate of smoking and excessive drinking, which directly increasing their cardiovascular risk. The third is dietary habits. Women are often focused more on balanced diets with fruits, vegetables, and whole grains, but may be more prone to nutritional deficiencies like iron or calcium that can indirectly affect heart health. Health checkups and awareness. Men, they tend to visit doctors less frequently and may ignore early warning signs of cardiovascular problems. While for women, they are more proactive in seeking medical advice but may misinterpret or overlook heart disease symptoms as they can differ from the classic symptoms seen in men. 5 is stress management. For men, they often internalize stress or use unhealthy coping methods such as excessive alcohol consumption or smoking, which increase heart disease risk. And lastly, sleep patterns. For men, they often suffer from sleep apnea, which are breathing problems during sleep, which increase heart disease risk.
Next, genetic predisposition. Different genders create different genetics. There are some genetics that can mutate and risking their cardiovascular health, either males or females. For females, there are two genetic mutations that can lead them into cardiovascular health. First, BRDM16 mutation, which can increase the risk of heart failure. This mutation affects heart muscle metabolism, which result in weakened heart function. Next, BRCA mutation. This genetic mutation is normally known for its association with breast cancer and ovarian cancer. But BRCA mutation also impact cardiovascular health, especially females who are after undergoing a removal of ovaries before the age of 50. On the other hand, males have the risk having a cardiovascular disease because of the Y chromosome, specifically haplogroup 1. Studies show that haplogroup 1 carriers have a 50% higher risk of being attacked by coronary heart disease (CAD) compared to other haplogroup. Lastly, males among 30s or younger with ACTA2 genetic mutation have a higher risk of CAD. This mutation can develop significant atherosclerosis despite having normal cholesterol levels and no other apparent risk factors. This mutation affects smooth muscle cells in the arterial wall, leading to increased stress and subsequent plaque formation.
So next is hormonal influences, which is hormones and the effects on heart. First, we have adrenaline, which is released by the adrenal glands during stress or physical activity. Adrenaline will increase the heart rate and boost the heart contraction. It also will improve the blood flow to muscle and preparing the body for creation. Example, by during exercise, adrenaline will help the heart to pump more blood to muscle to improving the body's ability and performance. Second is testosterone, which is primarily produced in testes. It supports muscle strength and body density. It also is a red blood cell production and regulates fat distribution. For example, low testosterone levels in men can lead to increased body fat, which can raise the risk of heart disease over time. Next is insulin, which is produced by the pancreas. It regulates blood sugar level and helping cell absorb glucose for energy and storage. Example, in athletes, insulin helps to maintain for stabilize in blood sugar level during exercise and increasing the risk of cardiovascular disease. In estrogen, they provide strong cardioprotective effect in women by enhancing endothelial function, reducing inflammation, and improving lipid profile. It is clear that decline in estrogen postmenopause raises the risk of hypertension, atherosclerosis, and heart failure. Besides, progesterone that mainly produced in ovaries will regulate the menstrual cycle and prepare the body for pregnancy. It also will maintaining heart health by balancing estrogen effect on blood vessel. Example, progesterone helps prevent excessive blood clotting during pregnancy and reducing the risk of heart complication.
As for the interconnected effect, hormones like insulin, cortisol, testosterone, estrogen, and progesterone interact to regulate the cardiovascular health. Hormones such as cortisols and also adrenalines, its function is to increase the heart rate, blood pressure, and also glucose level. As for estrogens, it's provide protecting by reducing inflammation. And as for the progesterone, it's complementing is for vascular health. And lastly, for testosterone, it depends on its level. When it comes to the imbalance of the hormone, it can pose into a high risk.
Conclusion: cardiovascular health is critical for overall well-being and longevity. Gender-specific difference in cardiovascular health arise from hormone-influenced genetic predisposition and lifestyle factor, which is contribute to variation in disease presentation and outcome between men and women. Women often experience these symptoms and face higher post-event mortality, while men are more prone to early onset cardiovascular disease due to biological and lifestyle factors. Addressing this required strategy to improve prevention, diagnosis, and treatment for both gender. This is a simple step for your healthy heart. Firstly, eat healthy food like fruit, vegetable, and avoid fried or salty meals. Next, you can stay active by walking, dancing, or doing any exercise that you enjoy for 30 minutes per day. You also need to pay attention to signs of heart problem like chest pain, shortness of breath, or feeling very tired. You can go to regular checkup for blood pressure, sugar, and cholesterol level. Cholesterol level can help you catch problem early. Did you know by making this small change, you can keep your heart healthy and live a longer, happier life? Thank you.